So I guess we all already know who I am. At least, if not for now, we've been here for a couple of days. Maybe let's reintroduce ourselves so that each and every one of us will understand who we are. Where did I come from? Welcome to Qatar. Why is my mouth not working? Jackie, please come to me. This this seems to be having a problem. What?
I forgot.
What do you forget? Okay. They will adjust the mouse and bring it to us. I'm Ms. Aisha. I'm your nurse supervisor. So for now, each and every one of us has a 2 years contract. So for this period of 2 years, we are going to be seeing my face. All right. And I am your first line of communication, be it administrative, be it patient-based, be it personal problems, and you really want to share it with someone, you can talk to me. I don't mind. Be it housing problem, if there is a housing problem and you need to say it to someone, I'm here. If you get so frustrated that you feel like there is a need to box somebody, don't box them yet. Just call me, we can talk about it. Okay? All right. I am a diploma nurse, an HND nurse. In my home country, they call higher national diploma in nursing, a bachelor's nurse, and as well as international healthcare management. So, if you talk about home care, I have worked as a home care nurse for 3 years in Dubai, and completely this is my 9 years of experience working as a nurse and 4 years of experience working as nurse manager or a supervisor, depending on where you're coming from. So you don't have to worry. As much as I will spank you a little, I will clean it. Okay? Alright, so let's start with Geraldine. Geraldine, tell us who you are, how many years you've been working, and so that we can get to know you.
Good morning, everyone. My name is Geraldine from Philippines. I passed the board exam in the Philippines year 2013.
Okay.
And then I started work as a nurse year 2015 because during after I passed the board exam, I go volunteer before.
Yeah, before you started working.
Yeah, I worked in the Philippines for from 2015 up to 2020. 2022.
Okay.
In a hospital. It's a community hospital.
Mm-hmm.
And then I worked before here for 2 years as a home care nurse.
Okay. So she has 2015 to 2022 will give us 7 years and worked in Dubai in the community service as well, like here for 2 years. So that makes it like 9 years
Yes.
of active service. I think she deserves a hand of applause. That's a whole lot of time giving services to the people. Thank you so very much. You can have your seat. Tell us.
Hello everyone, my name is Janelle Ilumin from Philippines. I passed board exam 2014. Then I started to work as a nurse in Philippines. Same with Ira and Geraldine, we have the same company,
Okay.
a community hospital. I started there 2015. I worked as volunteer nurse for 2 years. Then 2017 to 2022 as a staff nurse,
Staff nurse.
ER and ward. Then 2022, I worked as a home care nurse here in Qatar. Then last year, 2024, I stopped working because I took German language,
Okay.
but unfortunately,
You did not German with you.
I finished the German language, but I don't have employer yet. So
Oh, okay. So you decided to come back.
Yeah.
Inshallah. Within this 2 years period is a good enough time to still keep on working on that. Your dreams should never die, right? We keep on hoping for the best. Why having what it is? First, as nurses, we cannot stay without working for a long period of time. Even though they'll tell you, you have gap in practice, you need to start from training. You don't want to do that. So as long as you have to, you need to keep working while hoping for the best. Okay, thank you so very much. Let's give her a hand. we don't get recognized enough, okay? So when we have the opportunity, at least let's recognize the services we've given to the world by ourselves, while hoping that the world will join us someday.
Hi everyone, I'm Naren. I'm from India. I have completed my BSc nursing in the year of 2019.
19.
19.
Okay.
Then I have worked in cath lab for 5 years till 2025 July.
Which unit?
Cath lab, cardiac catheterization.
Cardiac. Who? That sounds like a whole lot of drama. You are very welcome, okay? Please give a hand of applause to some of us that ran away from the cardiac unit when we were asked to go to the theater. When I started working, I was sent to the intensive care unit. I worked for 24 hours. That was it, okay? And that was just it. I took care of a baby with the heart exposed and the monitoring and everything. Oh, Jesus. I said, no, I'm not going to die in my early age. The next day I was supposed to go to the theater. I never showed up. I stayed 2 days and I was sent back to the medical surgical unit. I've been working in the medical surgical unit, maternity and pediatric. But going to the intensive care, no, you can't say it, please. I'm not confident. Please tell us.
I am Agra from Kerala. I have worked in pediatric experience in 6 years. I completed diploma in nursing 2013.
2013? Wow, okay.
I have 6 years experience now. 6 year experience in pediatric work.
So you are the only pediatric nurse we have. We have a pediatric nurse, a cardiac. You two, you are pediatric.
When I was in
Yes, we will just continue with. We have 2 pediatric nurses, and you're an adult nurse. I'm equally an adult nurse, and she's a cardiac. This is a whole lot. You two will be our very first 2 pediatric nurses. And by that time, we will be moving over the money. What we have a pediatric nurse. It will be here from us. Sister Paramount, congratulations. That is a whole lot of services. I think dealing with the tiny human beings is a lot of joy because it makes you laugh, it mixes sometimes with you, and then they cry, oh, out of this world. Not to talk of when you have to pick their veins and you need to be fighting with their mothers and the babies at the same time. I cannot allow to pick my child, okay? Even though I'm a nurse. Don't try it. I will not allow it. So I too will need to be sent out of the unit for them to do it. But we thank God. This is the services we've offered. Each and every day we learn, and each and every day we grow. The most important thing is whether you are working in the clinic, in a hospital, in home care base, you are a nurse. And the basis is the fact that we are offering healthcare. The services we offer does not depend on where we are offering. Some might just be too strenuous, and why some are not. Like seriously, when I ever get into the cardiac unit, there's no way you are going to put me there. Even if I'm sleeping, I will get up and I will still get out. This is because I could not withstand the long hours, the anxiety that comes with seeing people in a dying state. I could not. I love the medical surgical, the maternity, because it's like we're in a happy stage. You get to treat patients, they get to go home, they get to come back and tell you thank you. In my home country, when they go back, they will make a small package for you, some food, and then they'll bring back to the hospital to tell you thank you. So I like that happy ending. Not the ICU where you get beaten 2-3 times per week because somebody died. No, I don't want that kind of rush. The maternity, you are being celebrated at all times, because each time you have a baby, the family comes celebrate you. Each time you take a baby, the family comes. I think these 2 units are happy units, and I like happy units. But for the side, my mental health is at stake. But others are called for the most intense. Others are called for whatever you are is your calling. As much as you answer what you've been called, you will have peace. If peace is what you're looking for, it's working. I have never had peace when I don't work. Yeah, I have never had peace when I don't work. I will tell you, when I was in Dubai, I tried 2 times to change my profession and look some kind of job that is out of the duties of nursing. I never got one. But each time I send my CV for nursing, I have 15 offers in the same week. So this is who we are, this is where we are stuck. But then we get the joy and the happiness for being here. And now that we have all decided to leave India to be in Qatar, and again, you came here before, you had the experience, you went back, and you still came back to see how this goes. Let's take it from here. Let's have a wonderful 2 years, and we can see where the future holds us. If we're still going to be here, we'll certainly still be enjoying the services we are to render. If after 2 years we decide to move on and see other places and see other countries, of course, the Lord will always guide us. Unless we already have our hellfire on earth. We can't be having hellfire on earth and in heaven. Okay, we say it only here. Let me see. Jackie?
Yes.
Having me change?
Yes.
The remote I gave you. She's wicked. Oh, come on, Colette. Come and get your phone. Come and get your phone. Put your phones on play so that it plays the light. Anyways, it seems like I will actively have to be controlling my Today we are going to be looking at the house rules. You can keep it with you if you want, or you can give it to her if you don't want the instruction. Do you have the Wi-Fi? Today we are going to be looking at the house rules. This is your first day of orientation. This is your first day of orientation. And what are the house rules all about? Of course, just like when we started working in the hospital, they took 2 days, 3 days, only giving you orientation of internal policies, external policies, what you should do, what you should not do. It's the same as we have here. And number 1, we'll be looking at attendance and punctuality. Be it in the office or be it at patient's bedside, we will take attendance and punctuality very serious. Number 2, we'll be looking at grooming. How we look is very important. That we look as nurses, we look tidy and all kept, because it is either we are going to be transmitting disease, the bacteria from one person to another because of our hair and nails and any other thing. So grooming is a very important aspect for us. We will be looking at that in details. Number 3, we'll be looking at language. Which language is permitted and which language is not permitted. Number 4, we'll be looking at respect. The respect we have with each other, the respect we have with our management, the respect we have with our patients and their family. Number 5, we'll be looking at the mobile phones. What are the rules and regulations that is going to guide us in using the mobile phone? Number 6, we'll be looking at the exams and the practices. Remember, we are going through the PNS system, and for the PNS system, we have to take our competency exams, which is different from nurses that are in private. hospitals or clinics, because they do not take competency exams. But for you, they need to be sure that you, being the only individual, the only healthcare personnel at the side of the patient, in the patient's home, that you can identify crisis, you can solve crisis, and you can refer the patient in a timely and precise manner. For the two of you, you've all gone through the PLS system and you know what it entails. So even though you both came in at the same time, they will leave you early. That is why the only first things you'll be taking is the community, rules and regulations, internal and external for PLS, reminding you again of what they want and what they don't want. Next, we will take you with the documentation, because there are a lot of documents that have been changed from the time you were here and now. And when we go through all this, we will send you for availability and off you will go. However, for the two of you, you are going to go through systematically all the different core competencies that are there and to know what it is all entails. And then you go in for the competency exams. If you make it, after which we will give you a patient. Is that understood? Okay, next we look at skills demonstration and re-demonstrations. With the competency exams is skill demonstration. So we will teach you what to do, we will show you how to do it, and then you will be given the opportunity to do this after. Which forms were given to you? An adult or pediatric? Pediatric forms? Which form? Your PMIs, which ones? Pediatric? Which forms did I give you? Janelle, which forms? Your PMIs? Because I'm sure I just gave a bunch of, I gave you pediatric. I gave you adult, right? I will bring you pediatric. You are having adult, yes. Okay. So you will have to learn how to demonstrate. In case of you, that will be for pediatric. You have to demonstrate what to do, how to do it in taking care of those pediatric, especially here will be most often children with special needs or children that are having diabetes insipidus. Okay? Next, we'll be looking at evaluations. Now, the evaluation comes in when you take a class, you take the pre-test, you take the post-test, and then you evaluate how the assessor or how the professor who was giving you that course, how she did, okay? If she was comprehensible, if she used many examples to make you understand, you will evaluate. And if you need more time, to take that course or there's something you do not understand, you approach the individual and then you request for more explanation. Next, you have break time. So within the time period that we are having teaching, we will give you as many breaks as you need. So you can take lunch, you can take breakfast, you can take coffee, you can take tea, just to relax. You can take snacks and make sure that you are in the right frame of mind to come. Remember that from one course right to the last course, there will be no repetitions. And you will be getting at the end of the day to take your exams. So we need you to always grasp everything that we are teaching. And when you get home, do a revision and try to get, if you can understand every aspect, because it will come and it will pass just once. Is that understood? Next, we'll be looking at means of communication. Now, if you want to communicate, the pathway for communication, where do you start from? To whom do you go to? And what is the reason and the best way to manage whatever situation? Is that understood? So this here is our content, and this is what we are all going to be talking about for this course this morning. I think I will take you right up to 12 and I will allow you to go home, rest, and then we can take it from there. Who? I need Jackie. Please send a message to the driver. Tell him that the new nurses will be picked at 12, but you guys will be picked at 2. I needed to make that so that you rest. Tomorrow is a long day, and tomorrow you continue your classes with me. For I think the next 4 days, you have your classes with me. And when I'm done for those 4 days, I will now move. You will now have the next teacher coming in. All right. Now, number one, we'll be looking at attendance. With our attendance, your classes will start at 9 and it will end at 4. Except for Saturday, then your classes starts at 9 and it ends at 12. Within those time periods, you'll be given enough time to rest. Next, tardiness allowed, lecture starts at 8. Don't look at it. This has already been changed because of the fact that we could not get you guys here at 8 because of the driver. Now we look our dress code. You are expected to dress correctly, okay? We cannot have any dress that is above your knee is prohibited. Now, not just for the internal policies to say that you're a nurse, but the policies of Qatar does not permit you dress exposed. 2, you cannot dress something that is shorthand, exposing all your hands or your neck. No. 3, your gown should not be the one that is showing your breast or showing your cleavage. Is that understood? As well as if you want to wear a jean, you wear a jean or you wear a trouser, it shouldn't be like you borrowed it from a madman. It should be nice, clean, straight, no kind of destroy on it. This is our dress code. So as to say, of course, we already know, the 2 of you have been here, so you already know the dress code, as well as you both certainly have the same culture and the people here. Always dress nice. Next, which language is permitted for us to speak? As long as we are in the office, the only language you are permitted to speak is English and or Arabic. So if you cannot speak Arabic, the only language you are permitted to speak is English. Now the 2 of you could be from India, from Philippines, you are from India, the other ladies are from Kenya. If we all start speaking your language is Tagalog? If we start speaking Tagalog, Hindu and Swahili differently, you will be feeling like maybe they are talking about you, and they will be feeling like maybe you are talking about them, but it might necessarily not mean that you are talking about them, right? So we want that the language spoken should be a language that is understood by everyone, so that they don't feel a type simply because you're speaking your language. Just respect for others, okay? Next, if you are on duty and the individual whom you are giving shift to, you are from the same nationality and you speak the same language, we will still recommend that you speak only English, because we want the patient to be inclusive in your handover. We want the care partner to be inclusive in your handover. And if you speak in a particular language that the care partner does not understand and the patient does not understand, that means you are not including them in that handover. Okay? So you speak in English or you speak in Arabic if you can, because of course all your patients will be Qataris and they understand Arabic. So if you are speaking in Arabic, they understand. As long as your patient and your care partner is involved in that handover, it's okay. So if your patient can understand Hindu or can understand Tagalog, good for me. Okay? And you all are speaking the same language, they understand, so nobody will be feeling like, what are they saying? So speak in a language everybody understood, which this language will be English. Because as of now, I have not identified anybody that can speak Arabic. Next, respect during lectures. Number 1, you are to listen, because it's very important for you to grasp in the most of the lectures. It will come just once and you don't want to miss the thing. And nobody distracting the other. 2, no chatting. So I can't be saying something and the 2 of you are trying to chat on something. I will actually give you the permission to do the chatting and tell all of us what it's all about. 3, participation. You need to participate in class. You need to ask questions. You need to answer questions. You need to get clarification on those positions that you don't understand what they are saying. Is that understood? Do not get a doubt and you take it home. Make sure that any doubt that you have, you ask the teacher that is in class. You can as much as raise your hand to ask the question, and if she asks you to hold on, you hold on until when she asks you to give it, but make sure you don't forget. Or you ask, each time you remember something, you can jot it on your book and wait until when she is free for questioning, then you can ask those questions. Is that understood? Okay. Next, we will go now to phones. How do we manage our phones? Of course, when you are here, I don't restrict you on using your phones. You can use your phones, you can make a call, and do anything you want to do. As long as you're in class, of course, your phones should not be anything that has to distract you. I need your attention in class. When you are on duty, the phone is not one of the instruments you should be using. Do I mean that you should not use your phone completely at all? No. If you want to call the hospital, maybe to request for medication, maybe to give a complaint to the doctor, you can use your phone. If I call you for a particular reason, of course you can use your phone. Or any other administrator calls you for a particular reason, of course you can use your phone. If you have an emergency back home that they need your attention, you can ask the patient permission to use your phone. Is that understood? You can ask the patient, please, I have an emergency, can I just make a call? Can I just text? They will, of course, they will not say no. But if you go on duty and you spend your time on your phone, rest assured they will report you. And that is going to land you into a disciplinary action. Is that understood? Next, when you are in the accommodation, if you want to play music, now the music that I enjoy as an African might not be the same music that you enjoy, might not be the same music that she will enjoy, might not even be the same music that Jackie will enjoy. Okay? So because of our differences in culture, in the music that we consume, when you want to listen to your music, put on your earpiece and enjoy the music that is good for you. Because it might be good for you, but others do not understand and they don't know why they are singing and find it offensive. That is one of the reasons. Reason number two, while you are working morning, someone might be working night. So imagine that I come back from a night duty and I want to sleep. And then you're playing music and dancing and shouting. How do you think that will make me feel? Very frustrating, right? So I will want to come and get a quiet environment to rest. And you are working morning. Imagine I come back in the evening and I am dancing and doing everything while you are struggling to prepare to go to work. Or while you need to work the next morning. It will not be something that you will appreciate, right? So let's keep the phone in a low tune and use our earpiece when we want to listen to music, when we want to watch a movie. If you want to make a call and people are sleeping and you can visually see that everybody is sleeping, excuse yourself, go outside and make a call so that you don't disturb others, because you will not want others to disturb you, right? You do it the same to others, the same way you want them to do to you. We are all nurses and we get to have the different shifts. Next, we'll be looking at what? How will evaluation be done? Number one, you have MCQ questions, which will be given to you as a pre or a post test. Number two, you have skill training, where you'll be going to the stimulation, you have your mannequin there, you practice what to do, how to do it, you have all the machines that you can test and make sure that you can manipulate these machines comfortably. Is that understood? Next, we have skill redemonstration. Now, when you are being shown what to do, how to do it, we will be expecting you to do it the same. Next, we have skill assessment. The skill assessment now will come to a situation, number one, you'll be going for shadow, where you'll be learning hand-on with other nurses at the patient's bedside. And when you finish shadow, you will come back, you will still have you will still be in the stimulation to prepare for competency. And at that level, you need to show the assessor what you know best. Next, we have checklist workshop. The checklist workshop, I think they have already shared to you the generic checklist, right? This is to make sure that you get it recorded. Now, if I am in class and I leave, you should bring me your checklist for me to sign. Is that understood? It is your responsibility to bring for me to sign. If you don't bring for me to sign, it's on you. Is that understood? Because this is one of the documents they have to show to the assessor when they come from the government to indicate that you attended this class and at this time. Is that understood? Okay, we will go to next. Means of communication. Now, because of the different communication pathways that as a home care nurse you have to talk with me, there will be time you'll be talking with the PLA staff, there will be time you'll be talking with the home office staff, the time you'll be calling the doctor, you'll be communicating with the family, the care partner, and me. However, these are normal routines. In a scenario where you have a problem, the only pathway, the single pathway that you have is to communicate with me. Because I am your direct supervisor and I am to protect you as well as take your information to the administration. Now, whether you want to talk with the quality, you want to talk with the head of nurse education, you want to talk with infection control, you want to talk with the director, you want to talk with the finance department because maybe you have a problem with salary, you want to talk with the HR or the managing director, you will talk with me. And I will take it to them. If they can solve it, they will solve it and I will bring back the solution to you. If they cannot solve it and they need to talk to you directly, I will give you the number or the pathway to get to them directly, or they will call you directly. Is that understood? But you do not leave me and you go to the managing director. Because if you have skipped the pathway, I will not get involved in whatever you want to talk to the managing director about. So whether it's soft or it's not soft, you have to deal with that. But if you speak to me, I will make sure that that is soft. And I will get back to you to give you what the evaluation or what the decision is. Is that understood? Okay. So with that, I don't know why these things are appearing here. Let's just go ahead. You'll see my email in front. With the communication, you can communicate with me on WhatsApp, on calls, and through my email. Now, for WhatsApp, for calls, if you don't have credit to call me, you simply need to message me, ma'am, please can you call? And I'll call you, okay? And for WhatsApp, you can send me a WhatsApp number. You all have my WhatsApp number, right? And you can send me an email. Now, in a situation where you want to take a sick leave, in a situation where you want to take an emergency leave, in a situation where there is a problem you want to table or complain, you should send that complaint through my email. That way, I can just print the complaint and put it over and take it to the next person that has to solve it. If I am to solve the complaint, I will get it solved and get back to you. But you can always message me what you want to say, and I will redirect you if I need it written through the email. Is that understood? So let's say that you are not feeling well and you call me, Mama, I cannot go for duty or I cannot come to the office. The message has been passed. But now the reason why I want you to send it through email is so I can print that email that is in your own words and send it forward to the management. Is that understood? How to request for sick leave. I am sure that the HR has spoken to you guys about sick leave, right? But I will take it all away. Number one, now we have 5 sick leave forms. The first form is a sick leave. Do you have the forms with you? Okay. The first form is a sick leave. The second form, we have the leave cancellation form. The third, we have the leave without pay form. The fourth, we have notice of return from leave form. And the fifth, we have leave guarantor form. Were you given all the 5? Now for each section, for leave form, in case you want to go for your annual leave, in case you want to go for an emergency leave, in case you have a sick leave, you will fill the leave form. And for an emergency leave, you will tell us what this emergency is all about. Now, as per the Constitution and the policy, the only position or the only time where you will be given a sick leave or an emergency leave to go back home country is when you lost an immediate family member. We are all grown-ups. We probably married. Our families, everybody is having now their own family. Now, your immediate family is your husband, is your child, is your mother, or your father. These are the four immediate family that you have. God forbid, if you have a loss, if you lost your husband, we will give you a 3 days working day emergency leave. Is that understood? Now, these 3 days will start from the time you arrive your home country. We have 1 day for you to travel and 1 day for you to come back. So this will make a total of how many days? 5 days. So 3 days for you to land home country, but 2 days which will be 1 you going and 1 you coming back. Is that understood? I am aware that there is, they told you before that 10 days. But you saw the policy was given to you, right? Yes, so it was just a slip of tongue. It's a 3 days working, and these 3 days is when you arrive home country. The first day is the day that you are traveling, and the second day is the day that you are traveling. Apart from these 4 individuals, we are not going to give you an emergency leave that will permit you to go home country. Now, the remaining leave that you can have is sick leave. And as per the policies, you have up to 14 days sick paid leave within a year. So if you tell me today, Mom Aisha, I'm sick, I cannot go to duty, I give you 3 days sick leave, know that your 14 days have reduced, right? You are now having 11 days for that year. If you tell me again some other time, Mom Aisha, I cannot go to duty, I'm not feeling well, and you need 2 days sick leave, 2 days will be removed. So long as you keep exhausting these 14 paid sick leaves, when you're exhausted, when you ask me again, I'll tell you for the year, your paid sick leaves have been exhausted. And this other sick leave, I cannot pay for that anymore. Now, how do you communicate in a situation where you have a sick leave? Number one, if you have duty tomorrow in the morning, and this evening you are not feeling well, send me a message and say, Mom Aisha, I'm not feeling well. Maybe I want to go to the hospital, or I am still in the accommodation evaluating the states. Because I know that you're already sick, I will start looking for what? Someone to relieve your duty in case you cannot make it the next morning. Because sometimes you might have cramps, you might have headache, you might have something like, the next morning you feel like, it's okay, I can go to duty. So you go to duty. But you tell me immediately and give me a maximum of 8 hours to schedule and make arrangement for your reliever, or you give me a minimum of 3 hours to schedule and make an arrangement for your reliever. If I get up in the morning and you're starting duty at 7 and you send me a message at 6:30, Mom Aisha, I'm not feeling well, I cannot go on duty, I'm sorry, you go to duty. It's not because I do not see that you're sick, but at that moment, what will I do? There is nothing I can do. So I will have to send you to duty and take 3 hours to make sure that I send you a reliever and then you can go back home. Is that understood? I'm not sending you for duty so that you should go and remain there, no. I will be making sure that I send somebody after you so that you can go home. But at that moment, I will still need to make sure that I see who to send. Okay? And again, we are working with the PNS. It is not my decision on who to send to duty. PNS is the one to decide. So if you are sick, I need to call the focal and tell the focal, my primary nurse is sick and I need to send a reliever. So I will send the documents and the reliever and everything to PNS to tell them this is who I want to relieve you with. They approve before I send the nurse to you. So because of this back and forth emails, it's not going to take 1 minute. And I cannot just send somebody to you without getting the approval from PNS. Is that understood? So that is why I need at least 3 hours to call, to send the email, to get it approved, then I can send somebody to you. Is that understood? But do not say without telling me you're sick. Because as much as I need you to go take care of a patient, I need you to be fine. So you tell me you're sick, I will make sure I look for a reliever that will relieve you so that you can sit at home and recover, or you can go to the hospital. However, for you to give me a sick leave that will be paid, you need to go to the hospital. You get checked, you get your sick leave approved from the hospital, and then you send that email plus the leave approval from the hospital. And on your book or on your timesheet, I will indicate a sick leave. That means it is a paid sick leave. But if I only indicate sick, that means you are not being paid for that because it was not a leave approved from us. And for us to approve it, we need that medication, medical report that you are sick, and we should give you 2 days or 3 days. As long as your medical report indicates that you need sick leave for 2 days, 3 days, 4 days, there is nothing I can do about that. I must respect that and give you those sick leaves to recover. Is that understood? And if I present that to the administration, they will have to pay you for those days because you are sick. Is that understood? Okay. Now we will go down to what? Leave cancellation form. What is the leave cancellation form all about? Let's say I'm taking my annual leave and I need to leave in September. So I already applied August 1st, indicating that my annual leave is due for September. And within 2 weeks, I realized that what I wanted to do home, I don't need to go. Maybe I can do it here. Or I don't even feel like going home at all. So I want to apply for leave cancellation. Your leave cancellation form should reach me 2 weeks before the day that you're going for leave. So that your flight ticket and every arrangement that was made should be cancelled. If you get up 2 days before the day you're going for annual leave and you tell me, Mom, Aisha, I don't want to go for annual leave, and they have paid for your flight back and forth, you will go. At that time, there's nothing I can do. I cannot cancel the flight. I cannot regain back the money. Okay? So you must give me enough time to be able to cancel your leave so that every arrangement is cancelled. And what will happen if you don't want to go home? You want to be here, just rest, without going back home. The leave allowance that was supposed to be used for your flight ticket and your incentive and everything that you had for your leave will be given to you in cash. Is that understood? So if I say I don't want to go home country, my flight and every other thing that was supposed to be done for me to go home country will be put together and will be handed to me in cash. Next is leave without pay. Now, leave without pay form will come at what time? Let's say one of my relatives at home is sick. Say my brother. Okay? My brother is not one of my immediate family members. My brother was one of my immediate family members when I was a child, when I was small. But because I now have my own family, he is now a relative, not one of my immediate family members. So something is wrong with my brother passed away, my brother is sick, and I need to go home. This is not part of the rules, but I really need to go home. It's going to be what? A leave without pay. The office is not going to be responsible in your flight, in your coming back, and in anything. So you are going to fill the leave without pay. So in this scenario, how many leave forms are you going to fill? 3. Number 1, you're going to fill the leave form indicating the number of days that you want to take Those days should not be more than 5. 2, you fill the leave without pay form. 3, you fill the leave guarantor form. And who is the one to fill the leave guarantor form? The person that you are making to stand for you. So if she wants to go for emergency leave and she wants me to stand for her, I will be the one to fill the leave guarantor form. And what does the leave guarantor form say? I am entrusting my 1 month basic salary, saying that she will come back. Is that understood? Now, never entrust your money for someone that you are not sure that they will come back. Is that understood? So if you say you are my friend and you know everything about me, make sure you understand exactly what is taking her home and that she will come back. Then you can entrust that money. Now, would it take your money? No, we will not. When the person comes back, the person is back. So when she's back, what will she feel? Return of leave. Now, when she fills the return of leave form, I will put every document together and I'll send to PNS that she's back. Okay? Because when you are going and need to tell PNS, then you are not more on duty. I am giving a new primary nurse to this patient for 5 days because she is having an emergency leave. So when she comes back, I will need to tell PNS she's back and she'll be going back to her patient, and I need a primary nurse who I put there temporarily to leave. Are you understanding? So you will fill the return of leave form and I will put all the documents together to indicate that you are back and you can start work. Do you now understand perfectly well what all of this stands for? For the leave guarantor form, if you did not come back, yes, if your friend went and did not come back, when she said she would come, those 5 days, those 6 days that you signed, what will happen is this: your 1 month basic salary will be cut off. Is that understood? So before you put your hand that cut, because I trust my friend, be sure that your friend is someone that you can trust and that they will come back. If not, tell the person, I am sorry, I cannot do it, so that they can go. Because if you must go and nobody is there to shut tea for you, what you can do is do what? Is pay the 1 month basic salary upfront. Is that understood? I will pay for the 1 month and I will go home. Now, if you give me the 1 month basic salary and then you go home and you come back when you said you will come back, I'll hand over your money back. Is that understood? Because this 1 month, what does it save us? It saves us the basics, or it saves us the expenditures that the company had inquired while they were bringing you back from your home country. Is that understood? So if you go, they will say, okay, we got back what we brought her here, so nothing lost. If you go and you had given me the money, when you come back, the money will be given to you and you go back to duty. Nothing lost, okay? You just need to be truthful and everything is going to be okay and you are not going to lose anything and you are going to go see your family. Is that understood? Okay. If this is understood, let's go to the next. The next we'll be talking about, okay, this is still on the leave. I think we've spoken about that already. We've spoken about this. Now this is your classroom as well as you have the stimulation room. Now you can take your coffee if it's break and you want to take coffee. I think somebody really wants to talk to me. Hello? Yes. Yes. I was supposed to stay longer to 2, But if you need me, I'll close by 12. Then come to my office and take the key. I will close by 12. By 2, alright. Yes. Yes, come on. Let me give you the key. Sorry for the stuff. Okay, now this is your stimulation room, and in this, the stimulation room is that way, and this is your classroom. So let's say that you were taking tea, or you're taking coffee with biscuit and all that. When you finish doing what you're doing, you already have your trash bin here you can use. And in there is equally a trash bin. Now if you spill something on the floor, you either clean it. If you don't want to clean it, you can ask the cleaner to do it, all right? Then be polite. If she had cleaned already and you spill something, be polite and tell her, please, I just spilled something, you can help me clean. If not, you take the rag and clean it yourself. Is that understood? So that we'll keep the place as clean as we made it and leave it the same way that it's clean. So before you are going home, make sure that the room is clean the same way you came in the morning. Is that understood? Okay. Oh, Jesus. All right. Okay, so now you can take your break and you rest, take something to drink, take something to eat. We will take the next class immediately after this.